Hi, my name's Mr Vikram Dhar, and I am an ENT consultant surgeon, and I work in East Kent, a fifth biggest trust in the United Kingdom, and one of the biggest head and neck departments in the United Kingdom. I deal with all sorts of ear, nose, and throat problems. I have particular interest in head and neck surgery and thyroid and parathyroid surgery. It's a question I've often asked, and I have to admit that as a child, you're exposed to the world around you, and both my parents were doctors, and they used to work incredibly hard, and they always, to this day, have loved their jobs and always came home grateful that they had the opportunity of helping others. And if you're doing fairly well at school and your parents all you know is of somebody that's able to help other people, it's quite a difficult thing not to do in a sense. So many doctors have parents that are doctors for that reason, I think. And that's what first exposed me to the idea of being a doctor. And, later on, I sort of understood that it was the right decision for me. I think at the age of 16, it's very difficult to be sure. You have to make decisions on your limited experience of the world. So, as a typical early 20 something, I wanted to not be exactly the same as my parents. So, first thing was I was definitely not going to be a physician. So, I knew I wanted to be a surgeon, and I thought orthopedics is for me. I can just play sports and be around sportsmen all the time. But actually, when I got into surgical training, and I was lucky enough to get on to sort of prestigious Royal London and Bart's rotation at Great Ormond Street and so on and so on, I decided that no, orthopedics was definitely not for me. And I was a bit sort of lost of what I should do because I've always thought I wanted to do orthopedics. And a dear friend of mine pointed me in the direction of ENT, and I immediately fell in love with it. The people in ENT seem to be humble but diligent and great sort of teamwork around them. And I never looked back. I think that feeling, that sort of constant feeling of reminding yourself of the privilege or being so, I think, valuable in people's lives when they are at their lowest. When I have a patient that's suffering terribly with their nose or ear problem or has a cancer of their throat or thyroid, and you can metaphorically hold their hand, take them through this difficult period in their life, and hopefully in a way that builds their confidence, sorts the problem out in an efficient way, and in a way where it makes it easy for them, relatively easy. It's never going to be easy when you're ill, but the last thing you need is a doctor that's not contactable, that doesn't come back to you, that doesn't communicate the issues properly. And I think I always ask myself and tell my trainees that treat your patient like they are your mother or your sister or father or your wife, because then you'll do your absolute best to make sure it's the best treatment you can give. I would hope that they value my ability to communicate what is going on and to sort their problem out in an efficient way. Being a surgeon and being a trainer of surgeons, we're very much focused on the operation side of things. And of course, it's vital that we do that absolutely perfectly. Ultimately, that's really the most important thing. But we can't let go of the other parts of being a doctor. And that is giving empathy, communicating, being efficient, being loyal to the patient and taking them through the whole process. So I think I would hope that they sort of acknowledge that, yes, I do a very good job surgically, but there's more to me than that. I'm hoping that I'm a doctor before anything else.